Good afternoon, ladies and gentlemen. It's a proud privilege for me, on behalf of Team Future, to introduce the doyen of healthcare. Dr. Shetty is a man who wears his heart on his sleeves and is committed to strengthen hearts around him. Welcome, welcome to the City of Joy. If I read his awards and accolades, the list is long. I'll scan through some. Padma Shri in 2004, followed by Padma Vibhushan in 2012, Economist Innovation Award for Business Processes, Ernst & Young Entrepreneur of the Year Award, Economic Times Entrepreneur of the Year Award, various other recognitions like Dr. B.C. Roy Award, Indian of the Year chosen by CNN IBN, Indian of the Year by NDTV. He has Doctor of Science degrees from IIT Madras and University of Mysore. And hold your breath, Doctor of Law from University of Minnesota, Karnataka Ratna Award, and so on, as diverse as these. Dr. Debi Prasad Shetty is a Fellow of the Royal College of Surgeons in England and has trained and worked in Guy's Hospital and Brompton Hospital in UK as a cardiothoracic surgeon. He is a professor in University of Minnesota Medical School and Rajiv Gandhi University of Health Sciences in Karnataka. In his own technical field, he has several pioneering feats. These include performing heart surgeries on newborn babies and operating to resolve complex problems of the heart. In fact, in the 60s, a young boy who heard of an African surgeon who had just performed the world's first heart transplant and dreamt of being a heart surgeon 30 years later, a flourishing surgeon himself, operated a 9-day-old baby in India, Ronnie, and created history. Dr. Shetty founded NH Narayana Hrudayalaya, I hope the pronunciation is okay, you'll have to correct me, sir, in Bangalore in 2001, as well as Rabindranath Tagore Institute of Cardiac Sciences in Kolkata. These institutes have assumed large proportions today. This has helped in reducing costs due to economies of scale, allowing complete heart surgeries for a tenth of the cost in USA. This has been an enormous contribution to society by making healthcare affordable. In fact, the Wall Street Journal has given him the title of Henry Ford of heart surgery. Dr. Shetty and his team have performed over 120,000 heart surgeries, 40% of which are on children. Another tremendous contribution to society has been the Yashaswini project, which is the cheapest comprehensive health insurance scheme at the rate of rupees 10 per month, designed for poor farmers of Karnataka state. More than 4 million people have been covered by this scheme. Coming to today's session, the topic is patient-centered care in a connected world. This matter is of crucial importance in the context of the evolving healthcare service industry. The first aspect would be use of telecommunication technology to provide remote healthcare-related services, and these would include real-time interaction between a patient and the provider, non-real-time remote transfer of patient's information to the provider, and finally, remote patient monitoring through the use of electronic devices, aiding collection of medical and health data, objective being that there should be no duplications, no unnecessary hospitalizations. Team Future, which has been in the education space for over 1.5 decades now, and have just forayed into the healthcare space recently with preventive and therapeutic healthcare, would seek the blessings of the doyen in its journey. The roadmap also of Team Future also says that we would like to go into a medical college. In fact, in the other room, when Dr. Shetty was talking to the press, the demand-supply gap of doctors needed, of oncologists needed, of radiologists needed. I mean, do we need more medical colleges? Do we really need a medical college to open up the PG degrees, the post-graduation? Would more of medical colleges bring transparency to the system? These are also related issues where I'm sure Dr. Shetty would like to reflect on his thoughts. Dr. Shetty, please. Thank you so much.
Yep.